When is the right time to check it?
She's asking the best time to check for the pelvic bone. Usually, it depends on the locality where you are doing it. I don't know if you understand. Now, if you check it at any time, you will find out even before the woman taking. You will find out. But there's no woman that will come here and tell her, "Kiga, check your book here." Whether the book is good or bad, I don't know if you understand. But usually, we will wait for 36, 37 weeks. There are some people that you will do the pelvic examination and it will induce labor, contraction. I don't know. So if you do it at 5 months, the woman might be forced to have a premature delivery. But at 36, 37 weeks, even if the contraction start that time, the baby is delivered, there's no problem. You understand what I'm saying? Again, when we want to do, some people were saying we should do it earlier. Why they are saying we should do it earlier is if you do it earlier, you can now start telling the woman, Imamu Kwenwa, most women at 10 weeks. In fact, had to until last day. So at 37 weeks, you can now advise them. This thing might not be able to pass through. If you tell them outrightly, it depends on that person's level of intelligence. You can tell them they run away and go to Nkewa nurse. The next time they get and they will tell you no no. I don't know if you understand. If there is slight possibility they will deliver, you will still allow them to go through labor. I don't know if you understand. But you do what we call double setup. You get the theater ready, you get the room ready. Whatever happens, you will be able to do it. Say to the husband, if you come, you will sign consent for surgery. But we will move in and start induction and all whatnot. If eventually the induction did not work, we will not need to start calling, where is the husband, come and sign for us. When you go to normal delivery, her bill might be like 10 or 20,000 higher than normal bill. But by the time she will come out to tell you that the hospital is so expensive, not quite normal delivery, but if you are sat down and told, the doctor should be on ground, the anesthetic should be on ground, there should be blood, everything should be ready. Because in as long as we want the baby to pass through, some of them might knock at their heart rate that is 130, 140 before. We jump to 160 or so. Common sense will tell you that this baby is about to go. And that time the baby is going by the clock. And then one day you will come to realize that somebody's life is dependent on your speed. So you don't take chances. You get these things ready. At the cost that eventually, if that person happens to deliver through the vagina, they might be 10 or 20,000 bigger than what he or she is supposed to pay. Even when in her own eye, there was no complications. But if you should follow us and see the preparation that was done for you, you can even dash us 50,000. No, but it's true. Sometimes you argue because you don't know the depth of the preparation that was done for you. Every child is precious. No matter how you look at it, it's important. Because when you everything, say, madam, or the will of God. And the people that saw her more dime, and say, hey, you need to go. And the trauma will follow her for some time. So if you see the preparations that, in fact, there are some that you have to get a neonatologist on ground. The neonatologist is there in case if this child refuses to cry.